Good afternoon. Please come on in and get comfortable. Just checking your intake sheet here, and primary concern that you have is recent fainting and dizzy spells. Okay. Tell me a little bit about that. How frequent are these spells? Okay. Do you have a history of any kind of fainting, passing out, blackouts, narcolepsy, anything like that? Okay. All right. And have you noticed any kind of patterns that lead up to this? Are there certain activities, certain times of the day where they're more prevalent, or different foods that you've noticed may be a precursor to this? Okay, I gotcha. Goodness gracious, I'm so sorry. Well, let me just kind of start our intake here real quick. And when was the last time that you had one of these? And so is there a difference between the dizzy spells and the fainting spells? It sounds like you're losing consciousness. Okay. And is it sudden? Is it something that you can, feel it coming on, and you're able to, find a safe place where you can sit or remain still? Okay. Let me start keeping some notes here. And apologies in advance about all the questions. Feel free at any point if any of these questions are not comfortable to answer. Just let me know and we'll move along. Okay, so for our frequency. And when was the last time, like time of day? Was it morning, midday, afternoon? Okay. And had you had a strenuous time prior to that, or was it like any other day? Okay. Do you want to tell me a little bit more about that? Okay. Okay. And have you ever struggled with things like anxiety or a heightened sense of alert, higher heart rhythm, anything like that? Okay. How about blood pressure? Okay. As far as your family goes, do you know whether or not there's any kind of hereditary high blood pressure or anything like that? Okay. And when was your last physical? Was everything typical, uneventful? Okay. How about medications? Okay. Do you know the dosages? Okay. How about any kind of other medicine, acetaminophen, aspirin, naproxen, anything like that? Okay. And do you take those as needed? Okay. On average, how often would you estimate that? Okay. And have you had any increase in the number of headaches, severity of headaches, anything like that? Okay. Okay. Any other family history that you can think of that might be relevant? Any relatives that have ever had any kind of epilepsy or any other health concerns similar? Okay. Okay. You may just not be aware of it. Understandably, I gotcha. How about your workload? You had mentioned stress and anxiety being a little bit of a characteristic. Is this something that's new? Has this been consistent or has it escalated? Okay. And for your workload, how many hours a week do you typically work at your main occupation? Okay. And is that typical? And is there anything about the current state of your work where things have become elevated in stress? Okay. And with any of these episodes, have you noticed that these happen while you're in a working environment, or is it before or after? Or doesn't seemingly have a reason? Okay. And a little bit of a personal question. Anything going on in your personal life that may be increasing the stress? Yeah. I get it. It's a difficult world right now. Yeah. And do you want to talk about that a little bit? I want to emphasize that this is completely confidential, so anything that you say in this session or this exam, nothing goes to your employer, to your family, other than any authorized individual that you've given us the ability to speak with, but per your request, we can also just leave that in completely confidential. Okay. Mm-hmm. And has that affected your eating habits? Do you typically eat 3 meals a day? Relatively well balanced diet? How about your caffeine intake? Okay. Tea, coffee, espresso, sodas, anything like that? Okay. And how many of those a day would you estimate? Okay. And any kind of recreational drug usage, anything like that? No judgment. Mm-mm. But I want you to be honest with your answers, and that way, if there is something that is, having a reaction to other medications that you may be taking, or just with your overall anatomy, we just want to know. Okay. Okay. And with your diet, do you have any other restrictions, allergies, anything like that you're aware of? Okay. Okay. How about your sleeping habit? Your sleeping patterns, habits? Do you typically get a solid 6 to 8 hours of sleep per night? Is it deep sleep? Do you cat nap throughout the day? Alrighty. So there has been a change in your sleep patterns. Do you mind talking about that a little bit? Is it a waking up frequently, not sleeping very deeply? Do you have any dreams that you remember? Okay. And for your dreams, do you feel that they're very vivid? Do you wake up with a heightened emotional state? Okay. And do you think that might have to do with your added stress levels at the moment? It could just be a coincidence too. It's just typically if you're having stress-related dreams due to a life event that's going on, your dreams may reflect that. Okay. Do you remember your dreams? How about lucid dreaming where you're aware that you're dreaming? Okay. And in the last several events where you have lost consciousness, have you awoken relatively quickly? Is it something where you're out for, a couple of minutes on the neighborhood of a couple of hours? How long do those usually occur? Okay. And to the best of your knowledge, what was the longest time that had gone on? Okay. And were you aware of the passing of that time? If you were, when you felt dizzy and you sat down, did you awaken and realize how much time had passed, or did it seem like you just kind of sat down, blinked, and then you were back? Okay. Have you ever hurt yourself in one of these instances where you lose consciousness? Okay. Okay, so a couple of bruises. Oh, goodness gracious, I'm so sorry. Gotcha. Alrighty. So that gives us a good bit of history, and I'd like to do some fairly generic tests. I do want to just start with blood pressure, coordination testing, make sure that things related to your cranial nerves are intact, that your perception of those sensations are indeed accurate. Also, I want to take a really good look at your ears, because I know that a lot of the times, especially with vertigo, if you've ever had a history of vertigo or ear infections, if the fluid in your ears is not able to circulate properly, you can sometimes experience dizziness to the point of losing consciousness, and that can sometimes be treatable with a couple of different methods. Okay. Let's start with some of the basics, and then we'll kind of move along from there. We'll do some blood tests at the end of this exam. Make sure that if you do have anything that is a deficiency, that might also be attributing to this, we can get you a couple more answers there too, okay? Okay. None of this should be bothersome, worrisome. If you do notice that you're beginning to experience any of these symptoms, you're becoming very dizzy, nauseous, you feel like you're about to go to sleep, let me know, okay? Okay. I'd like to get a little bit close to you for this. This is going to be just your standard blood pressure cuff. I want to see where you're currently at. You've been seated and relatively relaxed, it appears, for the last couple of minutes. Are you okay? Get ready. Okay. Do you have a preference for which arm we use? Okay. Just wrap this around. You might feel this pinch your arm just a little bit, okay? A little bit elevated, not too alarming though, given the circumstances. Also, I know sometimes when people come into doctors or medical offices, they can get elevated just because of the circumstance. Sticking with stethoscope testing, I do want to listen to your overall breathing. Just want you to breathe normally and don't focus on increasing the depth of your breaths. Just want you to breathe as normally as possible, okay? If anything, go ahead and try to relax a little bit, okay? And as I'm placing my hands here on your chest, are you experiencing any kind of discomfort or pain? Reach around your back here if that's okay. Okay. To your other side. Okay. And I'm going to focus on your heart here. I'll start on top, left side of your chest here. Second valve. Do you mind lifting up your left arm here just a little bit? Thank you. Okay. Just again to your back. Listen to your belly here. Do you mind lifting your shirt just a little bit? And is it okay if I touch your skin? Okay. If anything is uncomfortable, you let me know, okay? Just want to listen to your digestion a little bit here. When was your last meal? Okay. And do you generally have a good amount of water intake every day? And just push in on your tummy a little bit here. Again, let me know if this is just if this is uncomfortable in any way, okay? Same on your right side. This can sometimes be a little bit uncomfortable, but I'm going to just rest one hand on your chest. I'm going to tap the back of my hand. I'm going to listen for any kind of like reverberation or kind of cloudiness in your lungs. So if it's okay. All right. And as I do this, do you notice if there's any kind of want to cough? Do you feel that urge? Okay. Go ahead and just cough for me. Okay. So you can feel your abdominals are responding to that, which is good. And now this is going to be a little bit more of just a experiment. I want you to go ahead and just close your eyes and take a couple of very deep breaths in for me, and I'll breathe along with you here, but we want to observe whether or not you experience any dizziness. So just kind of start by taking one large deep breath in and hold it. And I want you to exhale with me, okay? 1, 2, 3. Okay. And again. 1, 2, 3. And again. 1, 2, 3. And again. 1, 2, 3. How does that feel? Go ahead and open up your eyes. And while you have your eyes opened, just observe, do you feel any kind of sensations of being dizzy right now? Okay. I'd like to take this moment while you're a little bit elevated here on your breathing. I'm going to take a really close look at your pupil constriction, dilation. So I'm going to put this funny looking headgear on. Alright. And just try to relax here for a second and look forward for me. Okay. You can just blink normally if you wish. Is it okay if I just place my thumb on the underside of your eyelid here and just pull this down a little bit? Thank you. Okay, and can you look side to side for me? Okay. On the side. Okay. Can I want you to look down for me? I'm going to pull your eyelid up. Go ahead and take another couple of deep breaths for me. Okay, go ahead and relax again. So this time I'm going to get really close to you and I'm going to use a light coming in from the side, okay? Okay. I'm going to pull up on your eyelid again here. You can just look down for me if that's more comfortable. Excellent. Okay, then look away to the other side. And on your other eye here. Okay. Your eyes do appear a little bit red, and now that may be just the increase of blood flow, oxygen, heavy breathing, and also if you've been deprived of sleep or if you're very tired, that can also be just a side effect. So this is sometimes a little bit tricky, especially when your eyes are really fatigued. But I want you to follow this light as best you can. I know this is going to put a little bit of a strain on your eyes, but just follow it best you can, okay? So you're going to have the light coming in from the side here. You're going to hold up 2 fingers, and I want you to just look straight forward, look at my nose. And I want you to tell me when you see these fingers move, okay? Same. Mm-hmm. So that appears to be very normal constriction, which is very, very good. And do you normally wear things like corrective lenses? Do you wear them full time or just for things like reading or driving? Okay. Take your temperature. Alrighty. Next part is going to require me to wear some gloves. I want to take a better look at the insides of your ears. I'm going to use a otoscope. I'm also going to take a couple of tools to very gently circle around on the inside of your ears, not too deep into the canal. I don't want to cause any kind of disruption or discomfort there, but you will feel a little bit of a cold instrument on the inside just to see if there's anything that is an obvious blockage, okay? Do you have any kind of sensitivities with your ears? Do you frequently have anything like ear infections, reactions during seasonal changes, anything like that? Okay, I'm going to start with your left side, if that's okay. I'm going to get a little bit closer to you, is that all right? Okay. So I know that this can sometimes be a little bit cold here, so brace yourself. Okay. Okay. And if I pull on your ear like this, does this cause any discomfort? Okay. Okay. Let's take a look at the other side here. And here. Okay. Now this instrument is kind of a very soft edged spoon, and I just want to scrape around on the outside as well as the inside of the canal very, very gently, I promise. But I want to see if there's any kind of if you have soap residue, any kind of debris that might be affecting your balance. Okay, so this might be a little bit cold as well. And this can sometimes even be a little bit ticklish. Okay. Okay. If you need a moment to cough, I know this sometimes can cause a little bit of a coughing reflex. Okay. Just take a moment if you need it. In the same way when I do anything with cotton swabs or drying out my ears, after a shower. I know that urge hits me too. Okay. All right, you ready again? Thank you. And do you typically have anything like a shampoo or soap, anything like that that gets stuck in your ears that you know of? Okay. Move on to your right side here. Okay. It's difficult to tell sometimes. Sometimes it can just be like earwax. Other times it can be a buildup of shampoo, conditioner, things like that. We'll take a better look at that under a microscope and see if there's anything that needs to be addressed with, okay? So just taking a general look at your ears, I'm going to palpate around various areas, and if it's okay with you, I'm going to manipulate the position of your head a little bit. I want to see whether or not we get any kind of stuttering of your eyes. That can sometimes be a sign of vertigo or something with the cochlear fluid not going through the ear canal correctly. So if it's okay with you, I'm going to first just start with my hands behind both of your ears, palpate all around the area to see if there's any swelling, elevated temperature, things like that. And then just kind of very gently maneuver your head position, okay? Okay, and again, if any of this feels uncomfortable, just let me know, okay? Is any of this tender? About right here, closer towards the front. Go ahead and open up your jaw a little bit. Okay. I'm going to continue towards the front of your face here. Go ahead and relax your jaw and just let your mouth hang open a little bit there. Lift up your neck. Glands underneath your neck and your jaw. Just going to maneuver your neck a little bit here. And if your head is in this position, do you notice any sensation of being dizzy? Your eye tracking looks good. Okay, and I'm watching your eyes to see if there's any kind of random movement. Get back forward. I'm going to tilt your head back. Okay. So everything looks good there. Press on your temples here. Does this cause any kind of pain or discomfort? Okay. For your hearing sensitivity, have you noticed, especially during these times where you feel a bit imbalanced, have you noticed that your sensitivity to sound has changed? Are you able to pick up audio? Is it almost annoyingly loud? Okay. I'd like to do a little bit of a blood draw here, just to test for any of your deficiencies, run a full panel on you, make sure that you're good and typical on that front. So, I'm just going to start by getting a little bit of blood. Do you have an arm that you prefer where to draw from? Okay. And just hold your arm here for me. Put a tourniquet. Okay. Just pump your fist a little bit here. Okay. Okay, go ahead and lighten up your fist there. Okay. Just a very small pinch here. There we go. Profile. Beautiful. Okay. Go ahead and relax. Get those labeled. We should have the results back in the next 2-3 days. It's typical, but that'll do full metabolic panel. If you're deficient in anything or if you're elevated, we'll be able to see that in those test results. And a couple of different things I want to make a suggestion for. First, while you're between appointments here, I'd like you to take a journal of what your day is like prior to this experience. So if you feel that you're experiencing one of these episodes that is up and coming, make note of what it is that you're doing, what your day has been like up until that point, and keep a journal of how you're feeling. Are you stressed? Do you feel like your heart is beating harder than normal? Did you have adequate sleep the night before? Things of that nature, just to kind of document your experiences. And then in a week or two, I'd like to see if we can get you scheduled for a sleep study. What this basically does is it allows us to put some nodes attached to your brain, not attached directly to your brain, but to your head, and we monitor your sleep, monitor your brain waves in your sleep, your breathing rhythms, your heart rate rhythm. While you're sleeping, we'll also have a series of different audio and visual stimuli during the tests. So if there's something that seems to trigger or to have a more exaggerated response, we can hopefully eliminate anything that might be interrupting your sleep. That way you can adjust accordingly for better rest. Also, with your journaling, if you are able to remember any of your dreams, pull out your phone real quick. Make sure that you note that down. What was it? What were you feeling? What is the sensation, even if you don't remember the dream? What was the overall sensation that you had regarding it? And that might help us put some of the pieces together on top of some of the more calculable measurements, blood testing, things like that. Come back. Hopefully we can piece together why this might be happening to you a little bit more. Sleep study can take a couple of hours. We usually will try to arrange it on a day off. Also, if you need a doctor's note, that would allow you to take the day to do so. We can get that arranged and reach out to your employer. But usually we want to allow anywhere between 4 to 8 hours, depending on what your sleep level typically is. Okay. I also recommend, if you can, think about what your typical ideal sleeping conditions are. What temperature do you like it to be? Do you prefer firm pillows, slim pillows? Are you a side sleeper, back sleeper, tummy sleeper? Write those things down, because we want to put you in the ideal, comfortable situation for sleep. Okay. On your way out, speak to the receptionist. I'm going to go ahead and text her right now to let her know that we're going to see if we can get that arranged for you. If there's any conflict in your schedule, let us know, and we'll reach out to your employer and see whether or not we can't get that accommodated a little bit better on your side. Okay. Well, my dear, I hope that you can take it easy for the rest of the day. Keep hydrated. Be mindful of your surroundings. If you do feel that you're unsafe to drive back, let the receptionist know. We'll get you a ride back to your place. Make sure you're safe. And if anything comes up in the meantime, please reach out to us. If it's an emergency, reach out to the appropriate departments. We're here usually about 14 hours a day, so if you do need us in those hours, please feel free to reach out and document as much of it as you can, okay? Do you feel safe and able to navigate from this point forward today? Any other symptoms that you've observed? Okay. All right. Well, you know how to reach us if that changes, okay? Oh, it's been a pleasure. Thank you. Likewise. Okay, we'll see you in a couple of days, maybe a couple of weeks. Okay. Take care of yourself for now.